Well, hi there, and welcome back to Naturally Recovering Autism. I am your host, Karen Thomas, and we are coming to you live today from Bold Brave Media and TuneIn Radio. And as usual, I am so happy that you're here because we have so many valuable resources to share with you. And I know that you're here as a proactive parent to help get the resources that you need, especially the natural ones, to be able to recover your child from their symptoms of autism. And I am here to share what I have learned in my over a decade of research now, what brought my own son to recovery from his symptoms of autism. And I had been told that he could not recover, that we should drug him and try behavioral therapies. But I wanted to find out for myself what could be done for him. And luckily I did, because my research led me to so many great natural resources, and I have put them now together in I have a free workshop to share with you to kind of help you understand a little clearer what I did in a sequence. And it's a free online workshop called The 4 Stages to Naturally Recover from the Symptoms of Autism. Stage 1 is healing the gut. Stage 2 is natural heavy metal detoxification. Stage 3 is clearing the co-infections of course, mold, Lyme, and Strep included. And then Stage 4 is brain support and repair. And you can get that workshop at naturallyrecoveringautism.com/free workshop. And I do have another guest with us today, Dr. Jodie Dashore, and we will be talking more about those co-infections. And this is a continued conversation that Dr. Dashore and I have been doing for you, because in the past we have covered some of the issues as far as Lyme and some of the natural treatment options, because as you may have remembered, if you haven't listened to that show, I will link to different show notes and links in for this episode at naturallyrecoveringautism.com/30, because this is show number 30. So you can get some of those past resources, but we're continuing this conversation because there are so many important aspects to know about these comorbid infections, and a lot of parents are completely unaware of them, and they are often the reason why your child will plateau and not get better, and or you just might reach a certain point and you're not understanding what's going on. And so it's important today we will be focusing on the co-infection of PANDAS, or Pediatric Autoimmune Neuropsychiatric Syndrome. But as that co-infection is triggered by another one of the co-infections, which is the mold biotoxin issue. And we will be sharing those resources and that information with you in today's show. And I'll be linking to some others that we've discussed. And of course, we will continue this conversation because there is a lot for you to know, and we don't want to be just, shooting a big fire hose at you with that huge amount of information, but we want to make sure that you have these resources to help your own child get better. So today we have Dr. Jodie Dashore with us, and I'm going to give her brief biography so that you have a little background on her if you're not familiar with Dr. Dashore. She's an internationally recognized pioneering clinician in the all-natural plant-based treatment of autism, Lyme's disease, mold biotoxin illness, PANS or PANDAS, nutrigenomics, and autoimmune illness. She works with children and adults in over 27 countries around the world. Dr. Dashore is a board-certified doctor of occupational therapy, neurology, with a postdoctoral specialization in neurosensory. She is board-certified as a holistic health practitioner and board-certified in integral pediatrics. Her past training abroad includes specialization in pediatric neurology and multiple naturopathic disciplines in Bombay, the UK, and the USA. Dr. Dashore is currently pursuing her PhD and board certification in integrative medicine with a special interest in quantum physics, and she's the founder of BioNexus Health Clinic in Marlborough, New Jersey. And Dr. Dashore also is an herbal specialist who is able to work with a lot of these comorbid infections naturally. And Dr. Dashore, congratulations. I know you were just completed the final certification for the mold biotoxin clinician certification, which is very important because there are just a handful of those available to us in the world, and we need more of you. So welcome, Dr. Dashore. Thank you for being here with us again today.
Thank you so much, Karen, for that wonderful introduction. And yes, it's indeed a privilege to be certified in Dr. Shoemaker's protocol. And there's only about 24 of us or so of us in the world that are able to work with children and are certified. in the mold biotoxin illness protocol.
Right, and a lot of people think, well, anybody could just work with the mold issue, but it's very specialized. And I found out myself with my own personal health and with my sons that we have that. There's a genetic issue, and about 29%, I believe, of the population have it. So it's important to know that this is inherited, and it will explain more about how your body can't dispel those toxins and what happens then in that case. But today also how PANDAS is associated with it and can be a trigger for mold, and PANDAS kind of go together because mold can affect the PANDAS. If for you listening to, PANDAS is an acronym for Pediatric Autoimmune Neuropsychiatric Syndrome, and you might hear the word PANDAS also, which means it's associated with Streptococcal infections. And I interviewed Dr. Rosario Trifoletti a few shows ago, and I will link again in the show notes. These show notes today back to that one if you missed that, to kind of go into deep detail on PANDAS and PANDAS. But we're going to talk about that today, as well as how the mold and the other co-infections are associated. So, Dr. Dashore, maybe you can just kind of tell us a little bit about PANDAS. Well, why don't we just start out there today?
Yeah, sure. I was thinking we could illustrate this a little bit with a case study. I just had a follow-up with Jason in South Korea, one of my patients, who the family was able to bring him over to the U.S. for a visit, and I've been following his care for about a year and a half now. So Jason had, in the beginning, he was born. Birth and early development was normal, had bad reactions to vaccines, high fever, uncontrollable screaming, and then recurring ear infections, upper respiratory infections. They were all deemed to be viral, so he did not receive any kind of antibiotics. He was diagnosed. He stopped speaking, avoided eye contact, started banging his head, and he was diagnosed with autism spectrum disorders at about 3 years of age. Now, Mom and Dad did everything they could with the biomedical aspect of it, with the stool testing, blood, hair testing, allergy testing, urine testing, the diet, the GAPS diet, the SCD, the gluten-free, casein-free. So they did everything they could, trying to heal the leaky gut. And for some reason, his condition only worsened. And, he would make a little bit of recovery, and then his condition would worsen. The head banging became more, and his OCD, his self-injurious behavior, just as he was getting older, closer to about 4 and a half years of age, the OCD was relentless. Because Jason had gross motor issues and fine motor issues, he would trip and occasionally, he would acquire a mild injury, and the OCD would kick in, and he would keep picking at this mild injury until it would bleed, and it just and make it into a huge wound that no one was really allowed near because it was hurting. So and for a nonverbal child, it was a very difficult situation for the parents as well as for Jason himself. So I believe the parents managed to attend Autism 1 year, and they heard about PANDAS and PANDAS. And as you mentioned, PANDAS is associated only with Strep. It used to be called PANDAS. So there is a slightly differing viewpoints that exist out there. Some think that, it used to be PANDAS, meaning pediatric autoimmune neuropsychiatric disorders associated with Strep, and only Strep. And then it was gradually transitioned to the name PANS, which is Pediatric Acute Neuropsychiatric Syndrome. And there still is a little bit of a gray area that we need to cover, because children with autism fall into a lot of gray areas, don't they? So it becomes difficult to see a textbook picture that, my child with autism went to bed and then next day morning just woke up a completely different kid, like, with motor tics, with OCD behaviors, with other symptoms of PANS, which I'm sure Dr. Trifoletti discussed when he was here, and we will go over those as well briefly, just to refresh people's minds. So I rarely see this textbook presentation with the PANS, and we don't really refer to PANDAS anymore in my clinic, simply because we haven't had a single child in the last 7 years that has come in strictly only exclusively with strep issues and has, what used to be called as PANDAS. So for me, it's PANS now. So let's go back to Jason, right? So he came in, and we did we collaborated with his physician, and we looked at his history, and we saw what was going on. Increased self-injurious behavior, increase in OCD, and then he started getting eye blinking. I started getting eye blinking motor tics, and mom mentions to me that on the way back from school, there was there's always been a little graveyard, and it was okay. The whole time was fine, and suddenly once this increase, this flare up in his OCD and behavioral issues. That was when Jason started to have a very scary and violent reaction each time they would pass the graveyard. And we know that in children with PANS, they have intrusive thoughts, and they have, morbid intrusive thoughts often. And Jason has, I've been seeing Jason for a couple of years, like I said, and he has since recovered a little bit of his language, and he has communicated to us that every time they would pass the graveyard, he would start thinking that he would start thinking of zombies and bodies rotting in the grave. So this is very macabre and morbid thoughts, which unfortunately, because of brain inflammation, it is uncontrollable for these children to go through this kind of suffering that they do, and especially the nonverbal children that are unable to let us know what's going on. So that would be a brief introduction with a case study as to what was going on. And wouldn't we know it, Jason's past infections, which were all deemed viral, I was pretty sure they were bacterial, and we found. Once we had his local doctor in South Korea run basic bacterial labs, so we had Jason was positive, very high ASO, which is an anti-DNase B, which are both which give us strep antibodies. So strep numbers were very high. He also had very high with HHV6 viral infections, Epstein Barr, mycoplasma pneumonia. I believe he even had chlamydia pneumonia as being a high active ongoing infection. So we ultimately saw about 11 co-infections that may very well be triggering Jason's PANS at that point. Have you seen this in your practice, Karen? Sorry.
Well, yeah, it's the same type of thing. It's the symptoms arise where there's so many multiple symptoms, or the child might be doing okay for a short period of time, and then all of a sudden, which just is the case with the strep and the PANS, that it can be a sudden onset. Like all of a sudden they're having all of these symptoms, the uncontrollable laughter or the tantrum or the, some of these things that you mentioned, and all these morbid thoughts as well, and the death and dying, and it scares the parents because they're wondering, why is my child having these horrible thoughts? Is there something, and it's interesting how the brain works in that way. I know that from my craniosacral background, we call the sphenoid, the bone behind the eyes, the dream bone, and it's easily destabilized, and people can have a lot of morbid and thoughts about death and dreams about death and dying when the sphenoid is out of balance. So I'm wondering if this brain inflammation that happens with these acute infections is creating that same type of aspect where the inflammation is affecting the brain and its ability to function, and the thought processes and the fear maybe around the amygdala overactive, which is often overactive in children with autism anyway. But then, I'm thinking about all of these craniosacral pieces that are involved, and kind of what I know about these thoughts and this sort of terror that can go through somebody, and depression is really big with that, and of course anxiety. So yeah, it definitely makes a lot of sense. Right.
So to recap, what happens in pediatric acute neuropsychiatric syndrome like this, it helps to illustrate with a case study like Jason's. So it is an infection-triggered but misdirected immune response. What happens is the antibodies that the immune system produces that are initially produced intended to fight these infections, they inappropriately end up crossing the blood-brain barrier, and they attack brain tissue. And this is what is called as an autoimmune encephalitis syndrome. That is, so encephalitis is inflammation and infection. And the infections we were able to elicit in Jason's labs. We had, like I said, about 11 infections that came about. And we proceeded to treat him, right? His local pediatrician and myself. Now, Jason's parents wanted to do only herbals and homeopathic homotoxicology, which is what I do. They wanted a complete plant-based approach. They did not want to do antibiotics because it had taken them a long time to help Jason with his leaky gut. So that's precisely what we did. We used customized herbals as well as published herbal protocols for all of these various co-infections for Jason. So we had antifungals, antivirals, antibacterials. These are all herbals. So multiple herbals, which were all antimicrobials. We were targeting all different kinds of infections, and he started to improve. We saw the OCD decreasing. We saw the anxiety, the vocal tics, the motor tics, the personality changes, the increase in sensory sensitivity, the increase in restrictive eating that had happened with him. So all of these symptoms started to subside little by little. And, but what happened was his parents heard about IVIG, right, or intravenous immunoglobulin treatment. So they brought this to me and said, we would like to see a little bit more improvement because Jason has not reached baseline yet. And this baseline was not, they were not speaking about Jason being, becoming neurotypical. They were speaking about Jason going back to the baseline before, he went through this huge flare, which was when his immune system went into PANDAS. And I guess next we will speak about how he recovers and about IVIG and the options available, etc. Is what we should be speaking about next.
Okay, perfect. We need to take a short break here, but please stay with us. You're listening to Naturally Recovering Autism. I am your host, Karen Thomas, and we will be right back and continue this discussion.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecoveringautism.com/free workshop, empowering parents with the resources to naturally recover autism from a mom who...
Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking about PANDAS as one of the co-infections of autism, and we'll be moving into a little bit of other triggers for PANDAS, and one of them happens to be mold. Dr. Dashore is with us today, and we're talking about she has a case study about somebody named Jason that she was treating, and he was having all of the symptoms of PANDAS, the pediatric acute neuropsychiatric symptoms, which again is the relentless OCD. They can be very clumsy. I do see them trip a lot. They have these morbid thoughts, uncontrollable thoughts and obsessions. And they're all triggered by many of these infections in their body. And so, Dr. Dashore, you were giving a little bit of background there, but now we're looking at, how Jason's doing, and he starts to recover, but he doesn't fully recover. So there was more going on that his parents needed to know about. Again, we call these the co-infections of autism. So can you give us some background about what happened next for Jason?
Yes, absolutely. So what was happening, as I mentioned, was his parents started seeing improvement, and I was there. I was along there as well. We started seeing improvements in the typical signs and symptoms of what we knew so far to be with PANDAS would be the signs of infection like pharyngitis, sinusitis, the rash, the dry peeling skin, the thickened toenails, rash in different areas of the body, the dilated pupils, the motor tics. These started to recede, and some of them disappeared. So it looked really good. Mom and dad came to me and asked about IVIG, which is intravenous immunoglobulin. They did not really want to do the IVIG per se, any IV treatment, but they wanted to explore, and they wanted to ask me if there was any natural treatments that we could be done to help, like something similar to IVIG. The one thing that I found useful, and it's not for this show, perhaps we can talk some other time, but I just want to mention it in brief, is camel milk. Camel milk is very different from cow's milk, goat's milk, sheep milk, because that was another thing that Jason's parents had looked at, the folate receptor antibodies, the Quanto study, the FRA antibodies, and Jason was moderately positive for the FRA antibodies. And, for some time there, using a milk profile that is quite different from your goat, cow, sheep milk profile, as in camel milk. In the beginning, it had been a little bit controversial with the FRA antibodies. Like, children with autism that have the folate receptor antibodies, should they be using camel milk? Then there was, there ended up being some clinicians who were using it and some weren't, and there really aren't that many specialists in camel milk therapy in the world again, because, we do have camels here in the United States, but we only have a handful of experts, maybe not even a handful, less than a handful of experts in camel milk. So I have found the immunoglobulins that are in camel milk to be not overly stimulating. Children don't really herc from it. It is quite possible to build up slow. One thing, and I know, Karen, you'll agree, is with our kids, because I have a son who is fully recovered as well, just like you, as many people might know. But with our kids, it is always beneficial to slowly build up things. It could be herbs, could be homeopathy. You can't just go in with full dose. And that's one of the things why things like antibiotics, don't really sit well with our children, because with antibiotics, in order to avoid resistance, you have to go in and build full dose. And that is often not possible, not to mention the immense GI side effects from regular meds. So what we could do with camel milk for Jason was, again, we started with 1 tablespoon a day. In the beginning, mom might have tried 1 teaspoon just to be like ultra careful, but he did so well that she moved up to 1 tablespoon, and we gradually every few days increased it and built it up to half a cup for him. So you have a child who was completely dairy-free, and then we ended up, right now it's been a couple years, and he's actually doing half a cup twice a day of the camel milk. And yes, camel milk is available in Asia as well. I'm part of a global camel milk not organization. It's a global camel milk resource group, where camel milk producers and veterinarians and scientists and myself, we all kind of collaborate to help patients to give people information about the benefits and the use of camel milk. So in many parts of the world, it's available. And Jason really did well. In fact, he had tree nut allergies. And those, after about 6 to 7 months on daily camel milk therapy, and I say therapy because it's not, you can't drink glasses and glasses when there is autoimmune and autoinflammatory issues going on in the body simply because of the immunoglobulins that are present in camel milk. So he started, his tree nut allergies started receding. And, he, I believe, is able to do pecans, almonds, and peanuts now. And keep in mind that none of these were life-threatening allergies. He had high IgEs, but the life-threatening allergies that he had were to cashews. And those haven't really recovered yet. But the others, it was a huge plus for mom, especially doing the SCD diet, where she was able to add in more to his diet. And he started gaining weight and height and growing as the infections went down. But the key being that, we did not see a complete going back to baseline before he went into this PANDAS flare. And that was a real mystery to his mom and dad. So we'll talk a little bit more about why that was. His PANDAS symptoms receded, but there were other symptoms which were still there.
Right, and there are other things then it can contribute to the autoimmune reaction. I mean, various allergens that we have, and those can be food, but they're not always food. A lot of people expect to look for, red eyes or runny noses, but allergen reactions can be extreme behavioral issues, or again can trigger more of these autoimmune issues from these other infections going in the body because they already have these weaknesses. We need to take a short break right here, but stay with us. We're going to continue this discussion when we come back. You're listening to Naturally Recovering Autism. Stay with us. We'll be right back. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking about the continued co-infection discussion we're having with Dr. Jodie Dashore. Today's subject is on PANDAS, or basically the pediatric autoimmune issues that create the neuropsychiatric disorders, and we were discussing before the break camel's milk, and we do want to make sure that we'll have Dr. Dashore give a little bit of background on that. That a lot of people think it's you'll just find camel's milk and just start your child on it, but there are some things to know about it. Not only starting really slowly, as we do with anything with our children, because they're ultra sensitive, and then titrating up, but also when to know that it's okay. And I'll give a link to, basically you need to be able to find the resource, but you need to probably be working with an educated practitioner in this. So Dr. Dashore, can you give a little background on what I'm talking about there with, how you would know if your child would benefit maybe from camel's milk, and then how to go about administering it with your child?
Yeah, sure, definitely. So as I explained before, there comes a point where all parents will start considering with PANDAS and PANDAS, IVIG or some sort of an immune modulating. We need to keep in mind that we are not really looking for immune enhancement, especially if there are co-infections like Lyme. Like one of the co-infections for children that can trigger PANDAS is Lyme disease, Bartonella, Babesia, ehrlichiosis, rickettsial diseases, Rocky Mountain spotted fever. Now these, so Lyme disease and a couple of these co-infections are known to suppress the immune system. In fact, there was a study early last year that showed that mycoplasma pneumonia, which is a co-infection, again, which is seen in kids with PANDAS, suppresses the IgM. when you do labs, you see the IgG and the IgM. So IgM is suppressed, and children with autism, when we run labs, if we are able to run labs, you'll see that typically the labs will show you many co-infections being IgG high. And, IgMs, if we are lucky, will come about. So erroneously, some parents might think, oh, we need to boost up the immune system. We don't need to boost up the immune system. You boost up an already autoimmune immune system. What happens? There's further autoimmunity. We just want to calm down the immune system. And, the scientific word for that is regulate the immune system. And one of the ways that I found to regulate the immune system, and get other benefits like gut repair with the leaky gut, as well as allergy relief, is using something that is all natural, that is camel milk. And camel milk, again, raw, pasteurized. I don't advocate raw. It needs to be at least flash pasteurized. Then the other issues with camel milk, not issues, the other aspects that have to be dealt with is folate receptor antibodies. If you have a child that has high FRA, you would very, very slowly titrate into camel milk. But for low to moderate FRA, I really haven't seen any issues. And the reason for that being is we are careful. We look at the FRA, at the folate receptor antibody results. Then we look at the methylation, the MTHFR, if there is any kind of, inflammatory issues going on in the body. If the MTHFR is positive, if, is it heterozygous, homozygous, compound or not compound. We also look at inflammatory markers. So what I'm trying to say is you have to look at the big picture. You have to look at the inflammatory picture, see what's going on before you introduce any kind of immune therapy. Could it be natural immune therapy like I do with camel milk, or could it be? There are a few parents that choose to do IVIG with their children on the spectrum, and there's no right or wrong. It is just the kind of approach you want to use. And the parents that come to me want to be completely plant-based and all natural. So one of the things I found was camel milk. Now, the best way to look for camel milk, the group that we have, it's only been a couple months, and we are trying to get together a complete resource guide for camel milk professionals in almost every corner of the world. But right now there isn't. But the best way to go about is to just Google, like I had a patient in South Africa that I spoke to yesterday, and I said, why don't you Google camel milk South Africa? And wouldn't you know it, one of my colleagues, Hans, has a website exactly by that name, camelmilksouthafrica.co.za, and it showed up for this patient of mine in Johannesburg. So that's pretty much what you should do, because the Middle East, India, Asia, the United States, camel milk, in Europe as well, camel milk is available in many, many places around the globe. So definitely, you should always ask Dr. Google.
And be sure that you do have some help administering it. I know, I did attend at the Autism One conference a year and a half ago as well, the discussion with the expert on camel's milk, and he was telling parents that you should start with 1 drop per day. People think, oh, it's a milk, so they're like pouring it into a cup and having their child drink a cup of it, and you can end up with some overstimulation of the immune system and some reactions that you don't want. So very, very important with that too. And then did Jason's parents give him camel milk? And how did you know he wasn't getting better? And so were you able to move into finding out what was triggering him not getting better again beyond the initial episode of the PANDAS?
Yes, exactly. Yes. Yeah. So we did start with camel milk. And as I mentioned, we had quite a good improvement with his leaky gut. We had improvement with some of the food sensitivities and some of the mini allergies with him. What was interesting, and I'll go into that next, is why he wasn't reaching baseline yet. because, he still had aches and pains and fatigue and some unusual pain, headaches and red eyes. So when we come back, I guess, from the next break, then we can discuss a little bit more about what was going on with him.
Okay, perfect. Because I'm sure our listeners are really eager to learn more so that they can help their children with that information. So again, we need to take a short break right now. You're listening to Naturally Recovering Autism, and we are coming to you live from Bold Brave Media. I'm Karen Thomas. Please stay with us. We'll be right back. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking with Dr. Jodie Dashore, furthering our discussion on the comorbid symptoms of autism. And today's discussion, so far, we've been talking about PANDAS, or the Pediatric Autoimmune Neuropsychiatric connection there. And Dr. Dashore, you're talking about a case study with a patient you had named Jason, and it might be good for you to go over some of those symptoms again that he had, because parents could then recognize that those symptoms mean specific things, and that what they can do from there. So could you go on with that a little bit too?
Yes, sure. We discussed his the flare up that he experienced with his PANS, and we also found out with labs that there were 11 co-infections underlying, which had brought about the PANS flare. And the PANS flare, we discussed, he had your typical, OCD, self-injurious behaviors. He had reduction and even loss of gross motor skills, fine motor skills. He had the dilated pupils. Now, once he was treated with the antifungal, antiviral, antibacterial all herbals, and camel milk therapy, and keep in mind, his mom and dad had already put in a lot of biomedical work for his autism diagnosis, with the diet, with the heavy metal detox, etc. So we were at a stage where Jason was doing great. I mean, he was doing well, but he still had symptoms. And some of the symptoms that he now had were fatigue, aches and pains, unusual aches and pains, like, there would be very sharp pain in his gut, and it would last for a couple seconds, and then it would go away. And of course, he would start crying, and that would last forever. The emotional reactions were overly dramatic. He complained about headaches. He would point to the head and sometimes do a little bit of head banging, trying to communicate. The eyes were red. His light sensitivity was very high. He developed there was a little bit of a breathing difficulty. He would be a little short of breath as he went upstairs, climbing upstairs to his room. His mom noticed appetite swings. There was issues with temperature regulation. At times he would have cold, clammy palms. At times he would be, sweating for no reason. And we had already addressed his babesia. So it wasn't night sweats. It wasn't any kind of, actually he did not even have babesia as a co-infection. He had Bartonella and Lyme, and Rocky Mountain spotted fever was what, the tick-borne infections that he had as part of his PANS infection panel. So anyways, where was I? Yeah. So some of the other symptoms, a couple more. We had mood swings. He still had difficulty with focus and concentration, and his handwriting still hadn't improved because his fingers developed morning stiffness. And this is a child, this is a really young child. So these were the symptoms that were the mystery symptoms that got me thinking. And I started questioning mom and dad a little bit. And to make a long story short, we found that Jason had been exposed to black mold and other species of mold, specifically Aspergillus, Cladosporium, Wallemia, and also, Stachybotrys, which is black mold. And upon further research, we found out that, and since I am part of Dr. Shoemaker's group, last year's conference, there were a couple papers that were presented that biotoxins can be a trigger for the PAN syndrome. So this was something practical, hands-on, that we had to look at and investigate further and see exactly where Jason was being exposed to mold and, help him with his biotoxin illness now. So poor Jason not only had autism, he had PANDAS with 11 co-infections, including Lyme and co-infections, and now he was dealing with the mold biotoxin illness, which is also known as CIRS, or chronic inflammatory response syndrome. And it's, two other symptoms which mom had mentioned to me, I just recall, was static shocks. Every time Jason would touch a door handle or his iPad or computer monitor, he would get pretty strong static shocks. And he had increased frequency of urination, which typically subsides after you treat for PANDAS. And when children are also exposed to mold and they are not showing, a reduction in frequency of urination, which is one of the classic symptoms of PANDAS and PANDAS, then you know that you have to look for other things. And one of the things to look for is mold.
So basically, you're treating for the symptoms of PANDAS, and they start to get a little bit better, but they're really not fully getting better, and a lot of the symptoms are remaining. Then you know that there's mold exposure, and that again, mold triggers. We have this genetic issue, and mold. If we have that, then our body can't dispel the toxins when we're exposed to mold. So you can even go into a public bathroom, or it can be hidden in your child's school or in walls of your home that you're unaware of. And so what happens is the body wants to fight that exposure, that mold, because it sees it as a toxin, and then it creates inflammation in the body, but it can't get rid of those toxins in the body. So it keeps creating inflammation. That's why it's called chronic inflammatory response, because it creates basically what we call a cascade of inflammation through the body and including the brain. So it very much affects, can give a lot of symptoms. I mean, everything that we're mentioning here, including complete brain fog, depression, there's so much to it that, you look at those extra symptoms, and it's important to notice that there can be aspects to mold. And Dr. Dashore and I have talked further at length in the past in mold, and we will do more in the future, but I will link to some things that we've talked about in the past so that you have, as you're listening, a little bit more information on that. Dr. Dashore, is there anything you want to add in here right now, more so on the mold aspect or on PANDAS or the connection?
Yes, absolutely. Yes, let's proceed a little bit with that. I'm happy to. So we did find where the mold was, and they had a washing machine issue, a basement issue, an ABA therapy center where he had attended for many years. As you know, ABA therapy often takes hours, and it's not always in the home. So we found multiple areas of mold exposure for Jason, and we did a full workup, a full CIRS workup for him. And again, CIRS is chronic inflammatory response syndrome, which is a multi-system and a multi-symptom illness. And, a little while back, the remaining symptoms that we spoke about for Jason, you can see that involves his circulatory circulatory system. It involves his visual system, involves his neurological system, his urinary system as well. So for him, it was a multi-system illness at that point. And I will discuss a little bit more about the genetic aspects of it. We should begin at the beginning.
Right. Okay. We need to take a short break right here. You're listening to Naturally Recovering Autism. Please stay with us. We will. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and today we are talking with Dr. Jodie Dashore on the connection of one of the comorbid infections, which is PANDAS, or Pediatric Autoimmune or Acute Neuropsychiatric Disorder. And now we've gotten into how one of the other co-infections of autism, which is the mold genetic issue, will actually trigger the PANDAS onset or disable your child from being able to recover fully from the PANDAS. So, Dr. Dashore, can you talk a little bit about the genetic issue with mold and some of the biotoxins and how this all comes together?
Yes, absolutely, yes. All biotoxins are neurological toxins, and that obviously becomes important for our children with autism or autism spectrum disorders. So about 25 to 27% of the general population in the world, roughly 1 in 4 people, have the genetic susceptibility for being able to easily acquire biotoxins, and the immune system doesn't recognize. So what happens is the body, and our patient Jason happened to be one of those, the body acquires biotoxins like mold toxins from the air, from living in a water damaged building. Now, what happens is the biotoxin enters the body, and in most people, these toxins are either removed from the blood by the liver, or they are attached by the immune system. They're broken down and they're excreted harmlessly. In people who don't have the right immune response genes, that is this 1 in 4 people that I just mentioned, these toxins can remain in the body indefinitely. They remain in the body, so it really wouldn't matter if Jason was exposed, to a mold at the age of 2, and his parents found out and they remediated the house, etc. But the biotoxins, the mold toxins, if they weren't systematically removed from his body, those would stay in the body indefinitely because he did have the genetic susceptibility, or his genetic buildup was that he did not have the right immune response, meaning the immune system doesn't recognize mold toxins as invaders. So the immune system doesn't really do anything about them. Sorry.
And then it triggers also, there's all of the cascade of inflammation and all the things that causes, but then is that what's triggering the PANDAS onset then also, because the body's immune system is fighting harder, and I know that part of the PANDAS is that the immune system attacks the brain. So is this sort of the trigger for the immune system, and then the immune system overreacting creates the PANDAS, and it's just like this whole domino effect?
That is correct, yes. We shall, it'll be another show, I'm thinking, but we have to go a little bit into the 2 branches of the immune system. You have the innate immune system and the acquired immune system, and what happens with infections with PANDAS and what happens with mold exposure. Mold exposure triggers, upregulates and dysregulates your innate immune system. The innate immune system is the one that you're born with. That's the factory installed immune system that comes with everybody. And it attacks the innate immune system, and that is why it causes this heavy-duty inflammatory cytokine cascade in the brain, in the body, which research shows that, many nuclei in the cortical gray matter in the brain are affected. There are areas in the forebrain that are affected. There are areas in the basal ganglia that are affected by the mold toxins. And those parents out there who have researched PANDAS a little bit, PANDAS and PANDAS, they know that the autoantibodies that attack the brain also attack the basal ganglia. So here are the core basal ganglia in the brain, which perform very important functions of emotion, social cognition, gross motor, fine motor, focus, concentration. That area in the brain is being attacked from both sides.
And so I know that you have some natural herbal protocols. Again, this isn't something that just you want to go to your general GP to try and work with. I know some people say, I know how to work with mold, and I heard that too, but I realized that they really didn't. And they were trying hard. They meant well. They thought they knew well, but if you don't work with this properly, it won't work. And really take care of the problem. So unfortunately, we are out of time today, but we will definitely need to continue this discussion, and Dr. Dashore will be back with us. We will further it. Any links for this show will be at naturallyrecoveringautism.com/30. And thank you, Dr. Dashore, again for being here with us today. I greatly appreciate your time, your expertise, and you sharing with all of us today.
You're welcome. My pleasure.
And thank you for being here with us to get the natural resources you need for your child. We look forward to seeing you next week. Have a great week and take care.